Okay, so we have a 79-year-old asymptomatic male with a prior cardiac history. We don't have a rhythm strip here, but we can still get the rate, 300, 150, 100, and this would be 75, so the rate's probably around 80, 85. The next thing I'm going to look at is the rhythm, and the rhythm throughout all the leads looks pretty consistent. So regular rhythm, look at the axis. AVF is kind of biphasic. So I'll look at 2. 2 is more up than it is down. If it was more down than it was up, I would call it a left axis deviation. Since it's more up than it is down, I'll go ahead and say that this is normal axis. And then now I can look at my PR, my QRS, my QT. So I'm going to look at all these things. I don't see any PR prolongation. I don't see any QRS prolongation. No QT segment prolongation, no changes in the ST waves that I see. There's slight depression here in V4, V5 that you might think are ischemia, but remember it has to be actually less than one little box, and it's not quite there yet, so we can't call that ischemia yet. The big thing that jumps out with you on this EKG is there's Q waves here, 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 and here. So the biggest ones being these. So this is indicative of a previous inferior MI, and as well as a previous possibly anterior lateral MI. Definitely here in the anterior lateral leads. So it looks like, I don't know whether these happened at the same time, whether they were different times, but basically this EKG, it's normal for this patient now, but he has had one MI that happened in multiple places. These are different arteries, that's why I'm saying multiple places, or 2 different MIs in his past history.